Move to tab 4.
Correct.
Okay. Ladies and gentlemen, we are honored today to have in our council meeting the Surgeon General of the state of Florida, Dr. Ladapo, who is going to speak to us for a little bit regarding fluoride in the drinking water. Dr. Ladapo, would you like to come up to the podium? And
No, you may not. You may not ask for the to speak to the attorney, and he is presenting on behalf of the city council right now, and he's not limited to 3 minutes.
all right, Dr. Ladapo.
Thank you. Thank you very much. I won't take up too much more than 3 minutes if I do, so I hope you're not too concerned. Now, I'm going to move this podium backwards a little bit so that my colleague, Dr. Mallon, is able to see her notes as she talks. Thank you very much for inviting me here today to the city of Tavares. I know I'm among friends because we have a similar feelings about Christmas ties. So that's a sure indicator that I'm among friends. So happy to be talking to you today about fluoridation in water. Now I'll tell you that this was an issue. If you'd asked me 6 months ago, it was not really on my radar. My wife had expressed concerns about it for actually a few years, and I just hadn't been able to make a lot of progress by reading the scientific literature about it, and I mostly just ignored it. But something very important happened a few months ago. A few months ago, a federal judge ruled that the EPA had to issue more regulation about water fluoridation. And this was remarkable. It came out of the blue for me. It was unexpected. And it prompted me to look more closely into the issue. And reading the judge's ruling, the judge basically, it was a really thoughtful and eloquent ruling, but the judge was basically saying that there are enough studies that show neuropsychiatric risks and other risks with fluoridation that at levels that are higher than the levels that we normally aim for in the United States, that the EPA had to do something. In other words, the proximity of community levels of fluoride in this country to levels that are known to cause harm was way too close. And those levels are 1.5 parts per million, whereas in the United States, the level that we fluoridate to is 0.7. Now, some people will argue that, oh, that's half of the limit. There's no risk. But you should know that the EPA typically, when there's a harmful threshold, they will set a safe threshold at a factor of 10, 30, or 100. So in other words, in this case, if the harmful level is known to be 1.5 parts per million of fluoride, and there's no debate about that. That's not an issue. There's no debate about that. It's been shown definitively. Then a safe threshold that the EPA would issue normally in this type of situation would be something like 0.15, right? Something like that. So much lower, or even lower in fact, but much lower than the level that was found to be unsafe. And the EPA does this because people are different. Some people are going to be more sensitive than other people to levels that are in the environment. So they set thresholds of safety that are much lower than the levels that have been found to be harmful. So I hope this makes sense, and I'm happy to explain more. But basically, the bottom line is the judge looked at the levels of fluoride that had been found to be harmful and said, EPA, do your job. You never allow people to be exposed to a level that is so close to a harmful level. And that was the bottom line. So I started looking more into the issue. And Some of the studies that I saw actually were written by my colleague here at the University of Florida, Dr. Ashley Mallon. And one of the arguments that you'll hear is that, well, you know, the harms have been found at higher levels. It's not been found at the levels we have in the United States. I want you to be very clear that that is false. So Dr. Mallon has done studies with populations in Canada and the United States that clearly, obviously, have levels that are the levels in the United States. And the same neuropsychiatric risks have been found. So again, this was an issue that wasn't even on my radar 6 months ago. But as I looked at the studies, looked at the judge's ruling, honestly, it was obvious to me that this was something that had to stop. It's just ridiculous to be doing it. And sadly, you know, so many members of the public health infrastructure, if you will, instead choose to defend it. And it's really sad. I mean, the best case scenario is that people are just too lazy to really dig into the science, and I hope that's the explanation. The worst case scenario is that it's more important to preserve public health, you know, tenets and public health victories than it is to actually take care of the people in your community. So those risks are very clear, the neuropsychiatric risks. It hurts intelligence quotient, the IQ of children. That's been shown, and that's terrible, like by a substantial factor, a half standard deviation. So huge effects. And there are other effects too. It tends to cause calcification in the pineal gland. That can affect dreaming, that can affect sleeping, that can affect other things. It also seems to be associated with thyroid dysfunction. In addition, it seems to be associated with early premature menarche. So in other words, the age at which some children, girls, will have their first period. So this is, the risks are just, I mean, it's appalling. On the plus side, you know, does it help teeth? Yeah, that seems pretty good. Fluoride does. Does water fluoridation still make a big difference for teeth? That's completely questionable. There is a group called the Cochrane Group that does systematic reviews, and they've done one of fluoridation. And it's unclear, that's what they say. If there is an effect at this point, it's in terms of dental health, it's probably very small. And that's partly because of the wide availability of fluoride in toothpaste and other improvements in our dental health and dental hygiene. So at this point, it's a bad practice for the health of communities in Florida. Honestly, I don't understand why anyone who can read and therefore can read the studies is still defending it. I really don't. But it's a practice that doesn't serve Floridians. I hope that every community, every municipality in Florida stops doing it, because it's an avoidable harm for really no substantial benefit. So at this point, I'm going to have my colleague, Dr. Mallon. Again, she's a professor at the University of Florida, and she'll share some of her research findings with you.